This is our Q&A for clinical microscopy. Topic: seminal fluid. Please subscribe to my YouTube channel or follow me on Facebook for more MedTech stuff. Alright, so number 1, site of spermatogenesis. Letter A, vas deferens. Letter B, epididymis. Letter C, testis. Or letter D, prostate. Answer here will be letter C, testis. Spermatogenesis refers to the production of sperm cells, and it happens in the seminiferous tubules found in our testes. Here is a picture of the male reproductive system, and here is the testes, where we will see again the seminiferous tubules responsible for the production of sperm cells. When sperm cells are produced, they will then go to the epididymis for maturation and storage until ejaculation. And if there's ejaculation, they will be traveling through this tube here known as the vas deferens and meet with the other reproductive organs in the form of seminal vesicle, the prostate gland, and the bulbourethral gland. And upon contact with these reproductive organs, each of these organs will be producing specific substances. Seminal vesicles will be giving off fructose. Prostate gland will be giving off enzymes, and the bulbourethral gland will be giving off the thick alkaline mucus needed for protection of sperm cells against the acidity of the prostate gland fluid or the acidity of the vagina. And once complete, they will be going through this penis and out. Okay, so one more reminder, one more summary of the male reproductive system. We have the testes, where we will see seminiferous tubules producing the sperm cells. In the epididymis, they will be maturing and be stored until there's ejaculation. And when there's ejaculation, they will travel through the vas deferens and meet with the other reproductive organs, seminal vesicles producing fructose, prostate gland producing the enzymes for liquefaction and coagulation, also producing acidic substances, and bulbourethral gland giving us the thick alkaline mucus. And that completes the seminal fluid. Okay, so answer for number 1 will be letter C, testes. Number 2, seminal vesicles produce letter A, acid phosphatase, letter B, fructose, letter C, choline, or letter D, alkaline mucus. Answer here will be letter B, fructose. As we have noted a while ago, seminal vesicles will have the function of production of fructose. Fructose, by the way, is the main energy source of our sperm cells. Okay, and by the way, we actually have 4 seminal fluid portions. 4 portions of the seminal fluid. All right, so let's list them. Number 1, we have the sperm cells. Sperm cells comprise the 5%. And then we have the seminal vesicle fluid, which will be 60 to 70%. We have here the prostate gland fluid, which will be responsible for the 20 to 30%, and the final 5% will be coming from the bulbourethral gland. Okay, so these are the portions of the semen or the seminal fluid. All right, number 2 is letter B, fructose. Number 3, the axosomal cap of a sperm cell is found in its letter A, tail, letter B, neck piece, letter C, mid-piece, or letter D, head. Answer here is letter D, head. It wouldn't be called a cap if it's not found in the head. Here is a picture of the sperm cell with its parts. We have the head, we have the mid-piece, and we have the flagellar tail. And as you can see, this violet area here is the axosomal cap or axosome. And the axosome will contain enzymes that will be needed for ovum or egg penetration. So the function of axosome is critical for ovum penetration. All right? One more time, the answer for number 3 is letter D, head. Number 4, the normal sperm head is approximately 1, 5 micrometers long, 2, 3 micrometers long, 3, 3 micrometers wide, 4, 5 micrometers wide. Letter A, 2, 4. B, 2, 3, C, 1, 4, or D, 1, 3? Answer here will be 1 and 3, letter D. The normal sperm head is 5 micrometers long and 3 micrometers wide. Here is again the picture of the sperm cell, and let's focus on the head. So one more time, the dimensions that we want to remember will be 5 micrometers for its length and 3 micrometers for its width. Be careful not to confuse the length and the width because sometimes this will be interchanged. Alright, in the choices, it might be 3 micrometers long and 5 micrometers wide. And can you just imagine a sperm with that dimension? Let us try. I'm just going to try to draw a sperm cell head which is 3 micrometers wide and 5 micrometers wide and 3 micrometers long. Can you just imagine how bloated this sperm cell is? It doesn't look so good, right? Alright, so yeah, let's not answer that one. So let us remember that it should be longer than wider. 5 micrometers long and 3 micrometers wide. Okay, and let's erase this one. Alright, so in the head, as we mentioned a while ago, there is this acrosome, and the acrosome will also have numbers to remember. We have to remember that it's occupying 1/2 of the head and should cover at least 2/3 of the sperm nucleus. Okay, 2/3 of the sperm nucleus. The acrosomal cup should be 1/2 of the head and 2/3 of the sperm nucleus, covering 2/3 of the sperm nucleus. The midpiece connects the head and the tail, and it also has a size. Let us remember 7 micrometers for that portion. And the tail should be 45 micrometers long. Be careful now, for the unit here may be replaced by millimeters. Alright, and can you just imagine a 45 millimeters long tail for the sperm cell? It's so creepy that you are able to see it by your naked eye. So please remember, it should be in micrometer, not in millimeter. Okay, so here is a summary of the numbers to remember. So we have the head, 5 micrometers long and 3 micrometers wide. The acrosomal cap found on the head should be 1/2 of the head and covers 2/3 of the sperm nucleus. The midpiece 7 micrometers and the flagellar tail 45 micrometers. Okay, so these are the sizes to remember. And again, number 4 is letter D, 1 and 3. The final number for this video is number 5. Round cells are 1. Immature sperm, 2. Mature sperm, 3. Immature WBCs, or 4. Leukocytes. Letter A, 1, 2, 3. Letter B, 2 and 4. Letter C, 1, 4, or D, 4 only. If your answer here will be C, 1 and 4. Okay, so the round cells refer to the immature sperm cells and the leukocytes. These are cells not normally found in a normal seminal fluid, and so their presence, if ever there are greater than 1 million of these round cells present in your specimen, will usually mean inflammation within the genitourinary tract of your patient. Inflammation in the genitourinary tract of the patient. Okay, so number 5 is letter C, 1 and 4. Okay, that's it for this video. I hope we understood well, and I hope you're doing good. And I pray that you'll do good in your exams in the future. And yes, I'll see you in the next video. Thank you so much for watching, and always remember that God loves you so much. Bye! Bye-bye!